Hi, and welcome to another episode of Talk Sex with Dr. S. Dr. S, how have you been doing this week?
I'm doing well. How about you?
I'm doing pretty well, and I think we both would like to thank all of our viewers for giving us such amazing questions.
Yeah, and all the hype about the show and everybody watching and asking for the next episode is pretty exciting.
Our first question is, if a woman is on birth control and she gets pregnant and doesn't know it, how can it affect the baby?
Well, this is a worry. Just pregnancy in general is a frequent worry for women in terms of lots of women want to know, well, I didn't know I was pregnant for a long time and I drank alcohol or used any other kind of substance, took over-the-counter medications, and took birth control. And they want to know, how does this affect the baby? It's really important to realize that everything affects the baby. However, in the first few weeks, and specifically in the first 10 or so days, that fertilized sperm and egg together, they're starting to divide and cells are starting to erupt, but they're not pulling a lot of nutrition from the mother's system at that point. So it doesn't affect it hugely, but it's important to keep in mind that you want to be aware of whether or not you're pregnant, and of course stop taking birth control as soon as possible.
Other than a missed period, what are some signs of pregnancy?
Oh, good question. And I think that one of our viewers had asked about what if they don't miss a period when they're pregnant. And so just want to cover, first of all, that it can be either way. When you're pregnant, you normally will miss your period, but sometimes there'll be spotting or there'll be a period that keeps coming. So moving on to the real question here, what are some other signs of pregnancy? Some women notice breast tenderness right away. They notice fatigue. They notice certain cravings, loss of appetite, gain of appetite, abdominal tenderness, and some back tenderness as well. And usually if you have abdominal tenderness, you don't have back tenderness. It usually tends to be one or the other. Some of the other things that you may notice would be nausea and changes in sleeping patterns. And sometimes the nausea comes, it's most disturbing or evident because it comes in the presence of foods that the woman normally likes. If she normally likes cheeseburgers, she might all of a sudden feel nauseous when she smells cheeseburgers, or certainly orders one and tries to eat it.
If a woman is on birth control and she gets pregnant and doesn't know it, how can it affect the baby?
Okay. Any substance that a woman uses has a potential to cross a barrier that joins the developing conceptus, which we're just going to call a fertilized egg a conceptus because it changes in some other names throughout the pregnancy, but for now I'll just call it conceptus. Any substance that the woman uses in her body can affect the conceptus, the fertilized egg. However, those substances affect it a little bit less in the initial stages of pregnancy. So during the first 7 to 10 days, just affects it a little bit less. You definitely, if you suspect that you're pregnant, and we just got done listing some of the symptoms of that, if you suspect you're pregnant, you can either go to your physician right away, or you can certainly just purchase a pregnancy test, over the counter for $6 and take it and see what the results are, and go to your physician after that or whatever. But it's very important to stop the use of oral contraceptives or any other kind of contraceptives that include hormones if you think you're pregnant.
The only thing that I'm slightly confused on is you don't end up missing the period on average until 14 days after conception. And you're saying in the first 7 to 10 days, so how are you going to know that you are pregnant? I mean, will the tenderness still affect at that early on in the pregnancy?
That's a great question. I'm afraid that statistics suggest that most women figure out that they're pregnant about 2 to 4 weeks after conceptus has happened. So that's generally 2 to 4 weeks after the missed period. So again, any substances that are used can affect the developing organism, but as it gets bigger, it draws on the nutrients of the woman more and more and more and more. It's not to say that at the beginning these things don't affect the developing conceptus, because they certainly do, but just a lot less. And one of the things to keep in mind is that women worry about this. And it's a great thing to worry about. However, if indeed the situation was such that substances would affect a developing baby that much that soon, we all wouldn't be as wonderfully turned out as we are. So that's something that all women worry about. When they first find out they're pregnant, the first thing they do is think about, oh my goodness, 2 weeks ago I had an alcoholic beverage, or 3 weeks ago this substance I was taking over the counter cold medicine or antibiotics. And it's important to check with your physician. And I realize that this question was specifically about birth control, but I think that it speaks to a larger question that women are always concerned about, and that is, I had these substances in between when conception happened and now, what's going to happen? And so all these things can affect the baby. It's important to ask your medical practitioner, but less so in the beginning stages.